there, welcome back to UWorld's question of the day. We are here on day 3 of ECG week, so let's go ahead and jump right in. The nurse is caring for a client who is experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing, so go ahead and look at this ECG strip. Let us know what you think by dropping your answers in the comments below, and let's jump right into it. So our correct option today is going to be option number 2, ventricular fibrillation, or VFib, as you may have heard it. So in VFib, our ventricles are quivering, they are completely disorganized. This is a life-threatening dysrhythmia. You can remember that VFib vibrates, which is kind of what this strip is depicting here. When we have a quivering ventricle, we're not going to have a sustainable cardiac output. And the danger here is that when we don't have cardiac output, we may not have perfusion to our vital organs, and this can be fatal, hence why it is life-threatening. So when we look at this strip, what we see is kind of a chaotic pattern. We're not going to really be able to effectively measure the heart rate here. We're going to see an irregular rhythm, no real atrial activity, which means no P wave, no PR interval, and really we can't even measure QRS intervals here. What we see essentially is the heart functions start to unravel. So the basics of what we're going to do to treat a VFib client is CPR. These clients are typically pulseless. We will defibrillate. You always defib VFib. We want to see if we can restart the electrical activity in the heart. We're going to give medications like epinephrine, amiodarone, as well as giving supplementary oxygen to these clients. And we may even need to get an advanced airway through these clients, like intubation, for example. So our correct option, again, is going to be option number 2, that ventricular fibrillation. Thank you so much for joining, and make sure to stop back in tomorrow.